We have already cut a check, the first check to GMH, and it is for $60,000. That's 60% of the proceeds for the gaming tax.
This good news comes from Department of Administration Director Benita Menglotnia, who says the agency continues to work on collections for August and September that have been reconciled with the Department of Revenue and Taxation.
Once that process is completed, then we will remit the remaining collections, and hopefully it will be smoother as we go along.
As we've been reporting, this revenue is a result of Public Law 32-60, formerly the highly controversial Bill 19. The law collects taxes and license fees from Guam gaming activities and uses the funds collected to fund sports facilities and activities throughout villages, as well as helps to operate an urgent care facility at the hospital. With the check cut and funds finally rolling in since the bill's lapse into law back in August, Committee Chair on Healthcare and co-author of the legislation, Senator Dennis Rodriguez Jr., reminds that the revenues alone are not enough to fund the up-and-coming urgent care facility, but more of a subsidy. He tells KUAM he's glad that we've finally begun to realize the funds, but also reminds that there's plenty of work ahead, including monitoring the flow of cash closely to ensure collections are accurate. Meanwhile, also established through Public Law 32-60, the Urgent Care Planning Committee is set to meet tomorrow to finalize plans for the new facility. The law requires the committee to submit the plan by January. Meeting bi-weekly, the committee recently voted to make the urgent care a separate entity from the emergency room. Reporting for Guam's News Network, I'm Crystal Paco.